Hospital staff saw him as just an elderly, cranky patient's relative. He questioned doctors' decisions, criticized treatment methods, until they kicked him out of the hospital, and 2 hours later learned who he really was. Welcome to Everyday People. Before we begin this powerful story of hidden identity, disrespect, and justice, tell me in the comments where you're watching from today. And if you believe stories like this need to be told, hit that subscribe button and help us share these stories. Street. Mary's Hospital was the city's largest medical center. Every day, hundreds of patients, emergency cases, and visitors came and went. Dr. Sarah Williams had worked here as an emergency medicine specialist for 8 years and had encountered every type of patient's family member. That Saturday morning was no different. The emergency room was packed. Nurses were rushing around. Doctors were changing shifts. At 10:30 a.m., an elderly man entered the emergency room. In his 70 seconds, wearing worn clothes, carrying an old bag, the man approached Dr. Williams. "Doctor," he said, "my granddaughter is having surgery here. I'd like information about the process." "Which patient were you here for?" asked Dr. Williams, looking at her computer. "Emily Johnson, appendectomy." Dr. Williams found the file. "It's a routine procedure. Dr. Martinez is performing it. Takes 1 to 2 hours. The man nodded. "Are they using laparoscopic method?" Dr. Williams paused. These kinds of technical questions weren't usually asked by patient relatives. "Yes, minimally invasive technique." "Is the trocar placement 12 millimeters or 5 millimeters?" This time Dr. Williams was surprised. "Excuse me? What pressure in mmHg are they using for CO2 insufflation? And which solution do they prefer as antiseptic?" Dr. Williams was uncomfortable. These questions were too specific, too technical. "Sir, these kinds of details aren't necessary for patient relatives. Please wait in the waiting area." But the man continued. "Was antibiotic prophylaxis administered? Cefazolin or ceftriaxone?" Dr. Williams was starting to get annoyed. "Sir, I'm the doctor. Treatment decisions are ours to make." "I know you're a doctor," the man said calmly, "but questioning certain standards is the patient's right." As the day progressed, the man continued to walk around the emergency room. He approached other patients, talked to nurses, made suggestions about treatment methods. A nurse came to Dr. Williams. "Doctor, that old man is interfering again. He criticized our IV insertion technique on a patient." "What did he say?" "He said the 18G catheter was too big, that 20G would be sufficient, and he claimed our vein selection was wrong." Dr. Williams was furious. Who does this man think he is? Does he think he's a doctor? At 3 p.m., the situation reached its peak. The man approached a heart attack patient brought to the emergency room. "Saint elevation in V2, V6 leads on the EKG," he told the nurse. "Anterior STEMI. You should call the catheter lab immediately." The nurse was confused. "Sir, you. And don't give nitroglycerin. Blood pressure is low. Fluid resuscitation is needed first." Dr. Williams came running. "Stop. What are you doing? This patient is having an anterior myocardial infarction. Emergency PCI is needed." "I'm the doctor here. Who are you?" The man remained calm. "I'm just trying to help." "Call security," shouted Dr. Williams. Security guards came. The man was removed from the hospital without resistance. Dr. Williams was relieved. Finally, they were rid of that disturbing man. 2 hours later, Dr. Williams' phone rang. Hospital director Dr. Robert Chen was calling. "Sarah, you need to come to my office. Urgent." When Dr. Williams went to the director's office, the scene waiting there shocked her. The hospital director, chief surgeon Dr. Martinez, nursing coordinator, and most surprisingly, that elderly man. But now he looked different. He was wearing clean clothes and holding a file. "Dr. Williams," said the director, "I'd like you to meet Dr. Henry Patterson." Dr. Williams' face went pale. Dr. Patterson is a retired surgeon with 35 years of experience in cardiothoracic surgery. He was department head at Johns Hopkins. And today he was here visiting his granddaughter. Dr. Patterson stood up. "Dr. Williams, When you had me removed from the hospital today, I wasn't angry with you. I understood. But you should know that. He placed the file on the table. I was planning to make a $2 million donation to this hospital for new equipment purchases for the cardiology clinic. Everyone in the room froze. But what I saw today made me think. The disrespect shown to patient relatives, the attitude displayed toward an experienced colleague. Dr. Martinez intervened. Dr. Patterson, we sincerely apologize. This was a misunderstanding. It wasn't a misunderstanding, said Dr. Patterson. It's a systemic problem. I was just asking questions, making suggestions. But nobody listened. The director looked at Dr. Williams. Sarah, can you explain? Dr. Williams's voice was shaking. I didn't know who he was. I thought he was a patient's relative. And patient relatives can't ask questions about medical issues? Asked Dr. Patterson. If they're a little knowledgeable, should they be silenced immediately? There was silence. Dr. Patterson continued. When I was young, I made mistakes like this too. Experience comes only with age, but respect should be shown at every age. Finally he spoke. I'm not canceling my donation, but I have one condition. A training program on patient rights and communication will be started at this hospital. The next day, everything had changed at the hospital. Dr. Patterson's story had spread. All the staff were in shock. When Dr. Williams went to apologize, Dr. Patterson received her kindly. Doctor, just learn from this, that's enough. We all make mistakes. What matters is learning. How can you stay so calm? Asked Dr. Williams. Dr. Patterson smiled. I worked in surgery for 35 years. I saved human lives. But I learned my biggest lessons from my mistakes. A month later, a new training program started at the hospital. Dr. Patterson volunteered to teach patient communication classes. Even in retirement, he was still teaching. Dr. Williams learned a very important lesson that day. Appearances can be deceiving. Knowledge and experience can come from anywhere. And most importantly, respect is everyone's right. And so we learned that sometimes the greatest teachers come from the most unexpected places. Sometimes the most valuable lessons are learned from our mistakes. Dr. Patterson's story showed us that experience comes with age, but wisdom comes from learning from mistakes. What matters is staying humble and always being open to learning. Now I ask you, have you ever met someone like Dr. Patterson? Someone you misjudged but later learned who they really were? Write their name in the comments, share their stories. Because here at Everyday People, we continue to give voice to misunderstood experts. If this story touched you, subscribe. Don't forget to like the video and share it. Help ensure these quiet expert stories are never forgotten. See you in the next story. And remember, if you see someone knowledgeable but different looking around you, listen first. Maybe that person has a lot you can learn from.